Payman. Senator Reynolds.
Thank you very much, Mr Acting Deputy President. I rise to speak in support of this Inspector General of Aged Care Bill 2023 and the role of the Inspector General of Aged Care. The coalition-winning government embraced this recommendation and pledged to create an Inspector General of Aged Care. This was done with the explicit intention of offering independent oversight over our aged care system to ensure transparency, accountability and confidence for all. The Inspector General will also have the ability to oversee the implementation of policies announced by the Labor government. Like so many other policy areas, this government makes promises they can't keep, they break promises, and again this was one of those really sloppy areas of policy development by this government. And let's not forget that during the election campaign the Prime Minister promised that every aged care home would have a nurse on site at all times by July this year. Now, anybody who has worked in government, or in fact anybody who is in this chamber, would have known that that was impossible to meet for a number of reasons, least of all that we don't have enough registered nurses in this nation, and we would certainly be taking registered nurses away from where they are already a scarce resource, particularly in hospitals. Now, 1 year later, under the Albanese Labor government's watch, aged care homes are closing down because of this election commitment. Now, it's one thing to make promises you know you can't keep. It's another to have the hubris and the stubborn will to not change a policy that is doing great harm. So 1st of July this year was a date that you talked to any aged care provider and they were dreading it because so many of them have not been able to meet Labor's expedited 24/7 registered nurses requirement, which has hit the sector amongst a very large shortage of suitable workforce, particularly, as Senator Little has just said, in rural and regional areas. Tragically, as a result of this government's, I'm not quite sure whether it's just incompetence or whether they just simply do not care. But so far we know of at least 30 aged care facilities have closed down as they were not able to meet the government's legislative requirement. And again, is it incompetence or is it the fact that those opposite would rather have aged care facilities close, particularly in smaller facilities in rural and regional areas, rather than admit they were wrong? And I suspect it is probably an unhealthy combination of both. So that means that residents who were dedicated community members who live close to their families have been forced to move out of their home simply because this government wouldn't be remotely flexible about staffing requirements during a workforce crisis. And now we are a month on when this expedited policy came into effect. And we now know that it wasn't just the Rush 24/7 policy that has forced aged care homes to close, but the punitive exemption criteria sadly have had the same effect. And again, those opposite just don't care. The Minister's prescriptive exemption criteria only offered an exemption to providers with less than 30 beds in modified Monash model, 5, 6 and 7 locations. For providers to become exempt from the requirement to have an RN on site 24/7, they must report every period of 30 minutes or more that an RN was not on site and or not on duty, and for the reason every 30 minutes. Now, anybody who has ever visited, been consulted with smaller residential aged care facilities know that they are already almost crippled with administrative burden in terms of time and cost, and this was simply ridiculous. And again, it seems designed to have done what it is now doing, and that is closing small community regional aged care centres. And in the last month, we've seen providers like Karaniti Summit Cottages in Mount Morgan and Petrie Gardens in Tiaro close, saying very clearly that this reporting requirement has placed such a high administrative burden on providers, they simply cannot do it. And again, that is something that should have been blindingly obvious to the government. And it's actually quite shocking that this minister is comfortable with watching homes shut down, not just because of her rush legislative requirements, but because of the niche exemption criteria she has determined. Again, hubris and a complete lack of care. Now, if anybody opposite actually went and visited any of these facilities and talked to the operators and the residents, they would see that they're crying out for help and not more restrictions. It is now time for the Prime Minister and the Minister to step in, admit you are wrong, and actually ensure that more aged care homes do not close. On this side, we remain absolutely committed to ensuring older Australians receive the care they need and the care they deserve. Australians cannot afford to see more aged care providers shut their doors, particularly when they are needed the most and where they're needed the most. So I'd like to remind those in this chamber about the Coalition's record in government. Now, those opposite are very quick to point out on pretty much everything that apparently it's almost like year zero every time they come into government. Everything was stuffed, nothing happened, and they've come in to fix things. Well, I tell you what, it is absolutely not the truth in most policy areas, and it is certainly not the case in this area. In government, it was actually the Coalition who called the Royal Commission into aged care quality and safety to ensure our oldest and our most vulnerable Australians receive the care, supports and also the respect of their dignity, and that we recognise appropriately the contributions they have made to our society. Now, the final report of the Royal Commission that those on this side of the chamber commissioned makes 148 recommendations. Following 23 public hearings over 99 days, 641 witnesses and over 10,000 public submissions, they are the product. So the recommendations are the product of wise and compassionate scrutiny of Australia's aged care system. Now, the Coalition's 2022-23 budget delivered just over $500 million in funding for aged care reform, which built on previous funding that we delivered, contained in the 21-22 budget and also that year's MYEFO. This brought our total investment, the Coalition's total investment in response to the final report, to more than $19 billion. And this was us who delivered a once-in-a-generation reform of aged care, provided respect, care and dignity to our senior Australians. And our 2022-23 budget responded to 10 recommendations specifically of the Royal Commission and built on our existing 5 pillars for aged care reform. We delivered a record investment across the aged care system over the forward estimates, from $13.3 billion in 2012-2013 under Labor. So when Labor was last in government, it was $13.3 billion, and we increased that to $30.1 billion in 22-23. So we actually grew the aged care budget in our time in government by 126%. And that was us on this side of the chamber. We called the Royal Commission and we have done a lot. We did a lot of reform, including an 126% increase in the aged care budget. And by 2025-26, funding in aged care, in our forward estimates, when we were government, was growing to an estimated $34.7 billion per year in the forward estimates. And also in government, we remain committed to providing our older Australians with support to live in their own homes for longer. This is why the Coalition increased new home care packages from 60,308 under Labor when they were last in government So I'll say that number again. Under the last Labor government, there were 60,308 home care packages. And by the time we came into government, we had increased it by 357%. So from 60,000, just over, to 275,597 new home care packages. So we just didn't talk about it, we delivered the care that people wanted to stay in their homes for much longer. And to support our aged care workers, we provided an aged care workforce bonus of up to $800 to eligible aged care workers. We did that on the 1st of February 2022, which cost $210 million. Additionally, approximately 265,000 workers benefited from the aged care workforce retention bonus. And this was the fourth workforce bonus that the coalition government had delivered, which was valued over $600 million. But you also listened to the experiences of Australians who gave evidence to the Royal Commission into the aged care quality and safety, and we took wide-ranging and decisive action to implement those recommendations. Now, our response included a 5-year implementation plan, which, as I said, was underpinned by 5 pillars. And those 5 pillars that we introduced when in government was home care, supporting those Australians who wanted to choose to remain to live in their home with support. The second was residential aged care services and sustainability, to improve and simplify residential aged care services and access. The third was residential aged care quality and safety, improving residential aged care quality and safety in all facilities. The fourth was we implemented a wide range of measures to support a growing and a better skilled aged care workforce. And fifth, we implemented comprehensive measures for governance to provide new legislation and stronger governance of the sector and of individual aged care facilities. And it is absolutely imperative now that the Albanese government gets this right. They've already, through their pre-election promises, made promises they knew they couldn't keep, and a consequence, over 30 aged care facilities have already closed. Hubris is a very ugly thing in politics, and it is even worse in government. And sometimes you have to admit you got it wrong and start again, or at least fix your mistakes. Another mistake, and huge impact, and again, an intransigent minister who will not admit that he was wrong. He pulled out a policy that 5 years ago that the Department of Health put to the then coalition government, and they rejected it as bad policy. But Minister Butler has still, again, intransigently supported the 60-day dispensing policy. Now, there's nothing wrong. I think that anybody in this chamber would say there's absolutely nothing wrong with a 60-day dispensing policy. But the problem is they're getting the pharmacists to dispense it for free. Now, I don't know how much those opposite know about market economics, but you cannot ask any small business, and most pharmacies are small businesses, to get paid for one service and provide the second service for free. I mean, it boggles the brain to think that those opposite do not realise you cannot do that to small businesses. But not only is it already starting to send some community pharmacies to the wall, it will also have a very significant and negative impact on residential aged care facilities, because the support that pharmacists have been providing in homes, through home care packages, and also to residential aged care, most of them have been doing, there's been some subsidy, but most of them have been doing Webster packs and home delivery to residential aged care facilities for free. And what it will now cost, so for something that people in aged care facilities have been getting for free, under this Labor government's proposal, will actually cost pharmacists, so for residential aged care, for the 208 people who will need the dose aid administration aids, will cost pharmacists, small businesses, $151.7 million a year, and they will have to start charging people in residential aged care. And in aged care, it will cost on average $806. So this apparent saving will actually cost people over $800 and again $400 for people at home care.
Senator
Shame on you,
Reynolds.
Labor.
Thank you, Senator